It is Tuesday, October 13th. And welcome to the Kahnawà COVID-19 Task Force update. It is our 141st update, and it is going to be a busy one. We have 4 presenters today. And first of all, just like to say I hope everybody had a very happy Thanksgiving. Hopefully everybody got to enjoy some good food as you shared, maybe not in the same household, but shared your food with your families. I know we did a lot of trading off. So anyway, we'll start things off with the Chief of the Kahnawà Peacekeepers, Dwayne Zacharie. Dwayne.
Good afternoon, Kahnawà. I'm happy to be back after the long weekend. I was asked to come on and do a little bit of an update after the long weekend. I know before we talked about it with Kahnawà, hoping that people would partner with us and help it to make it a little bit easier for our first responders. We, from the directives, we knew that people were saying they were going to do what they wanted to do. They weren't going to follow the rules. They weren't going to distance. They weren't going to stay away from each other. They weren't going to stay out of each other's homes, that sort of thing. But I'm happy to report that after the long weekend, after reviewing all of our files related to coronavirus, COVID-19, I'm happy to report that we had very few calls for service in relation to people who were gathering, large numbers, that type of thing, which is really a good thing. It's positive. I'm happy to hear that. It shows me, and it also shows the task force, that people are listening and that people are really trying to do all of the things that are necessary to remain safe, to keep the community and the people that they care about safe, which is excellent. This is something that the task force has been asking for people to do for a long time, and I'm hoping that it's starting to sink in even more, even with people who may have been a little bit reticent about following the rules. I think it's a good thing, and my whole reason for being on the show today is to talk about how positive it is and how happy I am that people actually did follow the rules, right? Masking, distancing, hygiene, all of that stuff, it's of the utmost importance. And as we go on, I know that some of the people coming on are going to have some other stories and some other pictures to paint about what's going to happen in the upcoming very near future. And I think if people from the community continue to work together, be good partners with the fire department, ambulance, peacekeepers, all of our emergency responders, all of our caregivers, I think that the community will be in a much better place going forward, and helping us all get through coronavirus as safely and securely as possible. So now I'll go, Kahnawà.
And thank you very much, Dwayne. Coming up next with some announcements on food services is from Sagotiat again has Community Services, the Emergency Food Service Coordinator, Ashlan Phillips. Ashlan.
All right. Good afternoon, Kahnawà. My name is Ashlan Phillips. As Joe had mentioned, I'm the Emergency Food Service Coordinator with KSCS. So I'm just here today to give a little bit of an update on our services. As many of you know, we do have 2 channels of services, the prepared meal service and the emergency food basket service. So the emergency prepared meal service ran from March 27th to July 31st. And at that time, we provided meals to over 100 clients throughout the community on a daily basis. So it was a lot of hard work went into that, and a lot of planning. We're very grateful to have been able to give that service to the community. The service ended in July as we and the surrounding areas either entered into either a yellow state of emergency or into the green in some cases. So restaurant services were no longer limited to our community members, so we felt comfortable in making that decision and stopping the service at the end of July. But we did offer to those who still do require the services, who were funneled to or more or less told to contact the Home and Community Care Services at KSCS, where they could be referred to the Meals on Wheels program, which runs out of the Elders Lodge. So there is still services available to those who do require it. And a big thank you goes out to the Rail, 207 Restaurant, as well as Morella's. They helped out tremendously in providing meals for all our community members. So right now, as everybody is aware now, with our community and the Greater Montreal area being in the red state of emergency, we have made the determination to restart that prepared meal service. And the intake process will begin tomorrow, Wednesday, the 14th of October at 9 a.m. And community members meeting the criteria for the prepared meal service will be able to contact beginning tomorrow morning. And that criteria is anybody 70 years and over, and or have either an illness or condition which limit their mobility and their means to prepare meals. So again, the intake begins tomorrow, 9 a.m. to 4 p.m., and you can contact KSCS at 450-632-6880 and ask to speak to the emergency food service intake facilitator. And we're just asking everybody, it is a new process. Again, we're restarting, but we're asking everybody just to be patient and be understanding that we do have limited resources available to us. So we want to try to provide the service to those who are truly in need. And for anybody else who require food supplements and do not meet that criteria, we do have the emergency food basket service still up and running. We continue throughout. And that's still partnered with the Zacharie food basket, and that is available to anybody who is currently out of work due to business closures related to COVID-19 or lack financial means to provide for themselves or their families. And there is no age restriction on that. However, again, we are asking for those who are truly in need to contact. And again, we do have limited resources, but we will do our best to accommodate as many people as possible. And just a reminder to our current food basket clients, if you have any comments, questions, concerns regarding either the date of delivery or times, you can always contact KSCS and ask to speak to the emergency food service intake facilitator as well. And I just wanted to say thank you to everyone who has made donations to the emergency food services, in whether it was the food basket or the prepared meal service. And we are very greatly appreciative of your generosity. Whether it was monetary donations or food items, we are always greatly appreciative. Donations can still be made at the Knights of Columbus Hall from Monday to Friday. We do have staff members on site between 8:30 and 2:30. We're just asking community members, like any other building, we are trying to limit how many people are in a building at one time. So if people can refrain from entering the building and call KSCS to make arrangements for their donations, that's always greatly appreciated as well. So I'm going to finish my update today. We do have a video coming up shortly showing the work and dedication that was put in to put together our food basket service on a weekly basis. And that was put together by the KSCS communications team. So for now, that's all I have to offer you today, but the video will take place at the end of the updates. So again, just everybody stay safe and healthy. Now I'll go.
All right, thank you very much, Ashlan. As this very busy Tuesday continues, coming up next is the Executive Director of the Zacharie Memorial Hospital Center and a member of the task force, Lisa Westaway.
Good afternoon. So I have a few updates to provide to you today. The first is about the Sunday drop-off at the Zacharie Memorial Hospital Center for inpatient. We had stopped the inpatient drop-off rather quickly, and several families have expressed that they wanted to have the opportunity to drop off a few more items before the winter. So we're looking at ways to continue this throughout the winter, and we will be having a drop-off this Sunday from 10. This drop-off, the time's going to be on the website. I actually don't have the actual times. I believe it's usually from 10 to 1, but we'll clarify that tomorrow on the KMHC website. So we have to limit, unfortunately, the things that can be dropped off so that the items can be cleaned more efficiently, or because we're in a more of a red alert, so we want to be safer. So the items that can be dropped off are clothing for winter. They need to be well labeled, hygiene products, and cigarettes. So those are the items that can be dropped off for this Sunday, but we'll be giving you updates for the next one afterwards. And please make sure that everything is well labeled, that it's in its own packaging, and there is no food to be dropped off on this drop drop-off on Sunday. I have a few follow-ups regarding the testing site. So the total amount of cases that we have as positives in the second wave are 12. Presently, there are 8 that have recovered, and therefore there are 4 active cases. So we are starting to see cases within the community that are not necessarily interrelated. However, this is what the important message that we want to give today is the fact that people are doing what they're supposed to be doing. So despite the fact that we have positive cases, this is not unexpected. So remember that if we want to continue to live a normal life, as normal as possible, we can expect to have cases. And the goal is to limit transmission as much as possible to a small group of people. And this is exactly what's happening. So because the community is following through, they are using distance, hygiene, and masks generally on a regular basis. Even though we have cases, we do not have a huge amount of contacts to isolate because of those positive cases. So we really just want to say congratulations, you're doing a really good job. We need to keep up this effort because what we are seeing around us right now, although the number of cases, new cases seem to be stabilizing, that can be a little bit misleading because we are testing less people. Remember, we are only testing symptomatic people. We are not testing those who are asymptomatic, and the Quebec government has really restricted access to testing because of the overload on all of the labs right now in Quebec. So, although the number of cases seem to be stabilizing, we are seeing an increase in hospitalizations, an increase in use of ICU beds, and an increase in death. We're also seeing our elderly population starting to be impacted, so a drastic increase in number of cases for people 70 and older, not just for the younger population. And so we have to keep up the good work that we're doing in the community so that we're protecting our elders and protecting those around us. So good job. We're really pleased with the effort that everybody is making. One thing I wanted to mention, something that we highlight on a regular basis, are our residents on inpatient or those living at the Elders Lodge. However, we don't often talk about our elders who are living at home. And those that are living in a residence have access to activities, and they have access to socialization with their peers and those who are living with them. But those who are alone at home are often very alone. So although it is safer for you to not visit with your relatives who are over 70 or who are living alone, we really encourage you to reach out on a regular basis, to offer your support, to bring groceries, to just check in, whether it be a loved one, a family member, or your next door neighbor, just to show that support to those who are at home, because they don't have access to socialization the way some of our elders do in the residence. So just wanted to send a reminder about that. Lastly, I wanted to talk about the community health check. You haven't heard about that for quite some time, but we've seen recently a reduction in number of people requesting testing. So a couple of weeks ago, when we had a lot of news about possible new cases, when we had some first new cases in this second wave, we had a huge influx of volume at the testing site. We were testing 35 to 40 people per day. However, we've gone down to 10 to 15 people per day consistently over the last week or so, and we're not sure that that we're really testing all the people who have symptoms. Remember, in order to contain the virus, we need to test as many people as possible. We know that there has been delays in receiving test results, and we feel that might be contributing to people not coming in to be tested. So I wanted to let you know that those delays have been resolved. We actually have received all results for those people who were tested up until today, and so we only have today's results that are outstanding. For those who were tested before today, therefore last week, you may may not have received your call yet, please be patient, because it's the nurse from the SISMO that gets the results from the labs and will contact you. However, there are no more outstanding testing results that we're waiting for. So that should not be a deterrent for you to come to the testing site. If you have symptoms, we really urge you to call. This is very important in our collective fight against COVID-19. So in the meantime, starting shortly, we will be redoing the community health check. We had a really good response with that the first few times that we did call and reach out to everybody. And so I will give you exact dates this week for when that will start. And we'll again be urging you to answer your phone and respond to questions so that we can bring you in for testing, or come to you if you can't come in, because again, that is really important in helping us have a better understanding of what's happening in the community, and therefore make better decisions about how we might move forward regarding visitation, regarding gatherings and such. Okay, so we thank you very much for your participation and collaboration, and we'll give you more information shortly. Thank you.
Thank you, Lisa. And of course, some good news with the drop-offs starting back up on Sunday. Again, more details will be forthcoming on that. Well, Lloyd Phillips is here. Of course, he is the Commissioner of Public Safety and the head of the Kahnawà COVID-19 Task Force. And as always, there's a little bit of news that we have to update you on, and also some thoughts from the Commissioner himself. Lloyd?
Thank you, Joe. Thank you, everybody, for giving some information today to help inform the community of not only what's happening today, but also some of the processes that are in place and will be in place soon to further support the community during this tough time that we're all living together. Also like to thank the community as a whole. I mean, I'm glad to hear the report that Dwayne Zachary had given regarding the level of I guess compliance that the community had done for the weekend. I know not gathering and respecting the directives that are currently in place. And I know it's been tough on everybody, you know. And you know, I had a FaceTime Thanksgiving dinner with my family, and I'm sure many people had followed suit. So we're all living this together, and and the more we have compliance, the more we have people doing what they should be doing. The goal is the shorter time that will be in this situation where we have to have strong measures in place. We're all looking forward to the time where the measures could start being decreased, and hopefully everybody's cooperation, not only in Kahnawà, but certainly throughout the province and throughout the country for that matter, we will gradually get back to that state. But if you're watching the news, and Lisa touched on it a little bit, it could be a little misleading if you just look at pure numbers, what's happening in the province. Although some numbers could look like it's slightly encouraging, but we also have to be clear that it's too soon to jump to conclusions and draw any determinations on various trends and stuff that's happening in the province. So it's by no means if you watch the news, it's by no means for a time for us to let our foot off the gas, so to speak, as we mentioned before. But it's also a time for us to ensure we take things even more serious. And like I said, and looking forward to hopefully that time in the near future where we can start looking at measures being reduced. So again, I'm glad to see what's happening overall in the community. Services that are going to be provided to the community are essential to ensure that the well-being of our community is taken care of, offered through KSCS and the emergency food basket. We also have the remind people that if people who are in need, if somebody is feeling stress and feeling anxiety, because of the latest measures and such, there's always somebody available. Through KSCS, they can be contacted. 450-632-6880, or if off hours, they always have somebody on call by contacting the Peacekeepers. There's always somebody available to sit and speak with you and help you, deal with some of the issues that you may be facing. So with that, I just wanted to once again thank the community, and we do have the video, as Ashlan mentioned, regarding the emergency food services. So that will be shown now, and also will be replayed on Facebook a little later on this evening. So with that, see you again soon. Goodbye.
Hi everyone. For those who may not know me, my name is Derek Montour. I'm the Executive Director of Kahnawà Community Services. I'm here to introduce today a video that we made to highlight the work and the effort that was put into establishing our emergency food basket services. I want to put a definite shout out to all of the KSCS staff members who have been volunteering so hard and diligently, as well as all the community members and staff members from other organizations who also volunteered. This critical service has helped countless number of families survive this COVID period with good food and regular support throughout this time. As we enter into the second wave of this COVID pandemic, I want to put a shout out to all KSCS staff members to continue to assist us, as well as all community members and organizations who have so graciously donated your time, your support, and your donations themselves. Nyao Goa to everybody. Let's keep at it, and we're going to get through this safely together. Nyao Goa.
My name is Ashlan Phillips. I am the Emergency Food Service Coordinator at KSCS. Presently, we are running the emergency food service during the time of the pandemic. We currently are partnered with the Zacharie food basket. This all got started back in March when the pandemic first began. As some people are aware, KSCS has a mandate to provide food and shelter to the community in an emergency situation. So this is our part right now. We are providing food service. So at the very beginning, we had two branches of the food service. We had the prepared meals, which was tailored to those over the age of 60 or those unable to cook or provide food for themselves. And we also had the food basket. So that's where we ended up partnering with the already established Zacharie food basket. Rather than duplicating services, we ended up just partnering together and run their procedures and take on how they were running things and put it to use here. So right now, where we are, we're at the United of Columbus Hall, and we're running the emergency food service out of here. We first began in March. We made our first delivery March 27th. We delivered to about 125 households in the community. And the following week, we delivered to another maybe about 20, and then the week after, I believe it was maybe another 80. So total, we were well over 200 at the very beginning. Our numbers fluctuated throughout. Right now we're sitting at about 150 households that we are currently providing food baskets to. And we do the deliveries. We have some people on twice a month deliveries. So they receive about 2 food baskets a month. And we also have those on a monthly system. So they receive 1 food basket a month. The food baskets are made up of a box of dry goods, anything from cereals, pastas, canned foods, that kind of stuff. And we also do fresh produce, so fruits and vegetables, and we also do a bag of eggs, milk, cheese, yogurt, and fresh bread. So a lot of people have given us some very good feedback. Actually, the main thing we did receive feedback on was people are saying that they're receiving too much food, which is not a bad problem for us to have. It could be the alternate where people don't have enough, and if that was the case, we'd gladly give more to those families. Even the larger families that we do have on our lists, we are supplying them with a little bit more than the single families or the smaller families. So the prepared meals service started the same day. Actually, it started on March 27th. We had 2 meals a day. We were providing the lunch service and the supper service to the elders in our community. And that was run out of the rail, who were quick to help us out. I made a couple phone calls, made some arrangements, met with their chef and their manager, and we got things going very quickly. So they were a big help, and they actually took on all our Meals on Wheels clients at the time, because KSCS does run the Meals on Wheels program on a regular basis out of the Elders Lodge. And due to the pandemic, they completely shut the doors at the Elders Lodge, wanting to keep the residents there safe and not have too many people going in and out of the building. So right away we had to relocate that service. So that's where we basically took on the Meals on Wheels service under the emergency food service, and we stuck, we combined our two lists and we had that working on the rail. So that ran from March 27th to July 31st. And towards the end, we actually had the 207 restaurant helping out with that as well, and we had Marilla's. So we had multiple locations still helping out with that service, which was great, and it was very helpful. A lot of community members have stepped up. Individuals, private businesses, making monetary donations and food donations as well. We've had, since the very beginning, we had countless donations, whether it was somebody showing up with a couple cans, from their pantry, or we had, bigger businesses in town donate thousands of dollars worth of groceries or check donations, and all that we're greatly appreciative of, because all that is being given out directly back to our community. So it's good to see community members helping out, helping their own in a time of need. So right now, the process that we have, we're here at the Knights 5 days a week, Monday to Friday. Our busier days are Wednesday to Thursday, when we have big deliveries come in. I order through national food provider, Gordon Food Service. They come in, deliver all our dry goods, number of different milk products, fruits and vegetables. We also go through fresh distribution, and we go through the milkman in town, Mike Montour. He helps us out a lot. So on those 3 days, we have staff from KSCS who are reassigned currently. If their jobs have been put on hold due to the pandemic, we have them reassigned with us here, and they help us out by unboxing, and then they go through, put together the boxes. We have specific lists. We also have drivers come in on Friday to help us deliver all the boxes to the specific people on our lists, which is roughly about 50 people per week right now. And it's a pretty extensive process. Every day, Wednesday to Friday is pretty busy in here. We have anywhere from 5 to 7 staff members in here helping out, and also at the same time, it's a little bit difficult, but maintaining as much social distancing as we can. We wear masks, gloves, all that, all the things to keep us safe and keep our clients safe. A general thank you to all those volunteers that we had. We did have people, we had, like I said, we had people giving us donations. We had Peacekeepers give donations. We had people volunteering from the fire hall. KSCS reassigned. We had some MCK bus drivers. We've had medical transport. We've had a number of different people who helped us out, and also just a general reminder to our clients as well. We're grateful and very happy to help. However, we know it does happen from time to time when people aren't home. So we just want to send out a general reminder to all our clients. If you're home, if things changed, your situation has changed, don't be afraid. Give us a call at KSCS. You can speak to the emergency food intake facilitator, and she'll be glad to help you, direct you in the right direction. Again, just a thank you to those businesses, community members who have helped us out. Club Res was a big help for us. Also, Mohawk Market has been very generous in their donations. We're always here. We're here Monday to Friday, 8 a.m. to 2 p.m. We have our doors open. So we're here accepting donations, if it's monetary, or somebody wants to drop off a small bag of groceries, anything helps, and it is going directly back to the community. However, we're just asking those, if you're going to be making a large donation, you can call our emergency food take facilitator at KSCS, and she can help get that organized for large donations, just so we can be prepared and we can get the manpower here if need be. So again, just Kahnawà to our community and to all those that have helped out, volunteers, KSCS staff, everybody involved.